Hey guys, Don here. Welcome to the $1 Million Minute with Podiatry Practice Mastery. I'm just going to have a little ask here. There are many people that listen to this each and every day, and so I appreciate that. If you enjoy this, can you please put a little comment on wherever you're listening to this, if it's on YouTube or if it's on one of your podcasts, just so other people kind of get access to this or they see that it is good. I know many of you have sent me emails telling me you like this, so I'm hoping to make more content. If there's other topics you want me to discuss, shoot me an email, don@podiatrypracticemastery.com, and I'll discuss about those or give you my take and what I learned from others. If you have other things you want me to share that are really working for you, that would be great as well. So this was my day. This was my Friday. So I had 35 appointments. There were 0 openings. This was my routine day, so just everyone knows. On Friday, I have a half day of routine where my patients, I see one patient every 10 minutes. And I have a medical assistant. She's a nail tech, and she's starting to do our nails. So the goal would be, as we've training her, Marjorie will eventually have like a parallel schedule for ourselves. So we'll go in, we're going to still monitor everything, the nails, we'll do the calluses and things like that. And that's how the first part of the day. So the first part of the day, I'm not going to go over too many things, but a couple of things that of point. The MVP was a patient that came in. They had seen another doctor for a wart, were treated many weeks and even months with different types of treatments, and they didn't get better. And then they came over to see us for Swift. So Swift, I used my patient presentation. If you don't have those, you can go to patientpresentations.com and you can kind of get all my presentations that I use. I used the one on warts, and I went through it and gave him the option of doing Swift or doing Cantharidin and all the other treatments, and he opted for the Swift and booked 4 appointments. Another thing, if you want, let me know, but on my consent for Swift, the front side is the consent, and the back side there's a place for 4 appointments. So it actually has appointment 1, 2, 3, 4. So those are all set up that way. So the patients are actually getting pre-scheduled for those monthly appointments. Just a kind of a way to kind of get people. You could do the same thing for example, Shockwave or anything else if you want to do when you want to do multiple appointments. The other thing that worked today was a patient that came in and they wanted to do laser. I tend to talk patients out of laser if they are good candidates for terbinafine. But what I use is this sheet that I use is called the treatment sheet, the nail fungus treatment protocol. And on there it has the stuff that you do for the medication. Then it has the laser on there. And so I do it in passing when I talk about the laser. I use it as an anchoring technique. That just means I go through the oral, which is usually what I recommend, and then I say, okay, you could do the laser, which is $1,500, but with the other add-on things, it's about $1,700, and I don't think it's as effective. And so we could switch over to the oral if this does not work. I probably talk more people out of laser than into laser. That's the way I do it. But the point here is when I talk about the laser, I use that as an anchoring technique. So if I say that the laser is about $2,000. Then the additional $200 that they're buying for the shoe spray and the UV light and the biotin and stuff like that is really nothing compared to it. So it's a much smaller amount. Okay, let's get into the day here. There was one patient, 63-year-old female, that had tinea pedis, was a routine patient, and I put her on ketoconazole, so I was able to do the routine and get the office visit. There was another patient that got Lamisil 1, so this is the nail fungus number 1, where I ordered LFTs and I gave them the terbinafine, and they got the package. This was a 75-year-old female. There was another patient that had a diabetic foot exam. These I do yearly, around the month after their birthday, so they did a CDFE. And I try to pick a non-diabetes code, so this gentleman had Charcot, so I used Charcot, kind of a stable Charcot, as the code. Then starting in the afternoon, these were other patients that were non-routine. The 74-year-old man, he came back. He had a painful exostosis on the medial 5th digit from rubbing on the 4th, and we trimmed it out before a few months ago, and it came back, and he wanted an exostectomy. So we have an MIS kit here where I do a little incision and I rasp down that right in the office, and it's a very easy procedure. We're going to schedule that for him at a future appointment. There was another patient as well. This was a 35-year-old patient that was preparing for the Boston Marathon, and she had pain in the sinus tarsi region on the left, and I put a little bit of cortisone in that area to calm it down, and she didn't really have anything else going on that of concern, but I did do a little cortisone. Another patient was a 71-year-old patient that needed a partial nail avulsion bilaterally due to chronically ingrown toenails with that really deep callus that was in there that's underneath the nail. So I had to get the nail out so I could get the callus. Another 54-year-old patient. This one wanted to come in for lunula. They actually came in looking for laser, and they decided to do the nail sample and possibly do the oral medication. This was another patient, as I mentioned before, the MVP, 68-year-old gentleman that's been dealing with a wart, the MVP, and he did Swift number 1. Another patient was EPAT number 5. This patient had plantar medial heel pain, has one more. Another patient was a 72-year-old female that we did a diabetic foot exam on her. And other patient here was a patient with a 66-year-old that had bilateral nail fungus, and did a nail sample, and I'll see them back at the next visit. And then finally there was a patient that was a 54-year-old who, this was kind of a complex one. This patient was seen by an orthopedist locally, and he had insertional Achilles tendinitis, supposedly with a Haglund's. I didn't see much of a bump on the back, but the doctor detached and reattached the Achilles, and I guess took off a bone spur. There wasn't much of a bone spur there. Using 2 anchors, they were metallic anchors. I usually use the speed bridge when I do these, which aren't very frequent anymore. But the one side was fine, and then he did the other side, and it just never got better. And he was struggling, did physical therapy, was never getting better. This kind of insertional Achilles tendinitis. And we opted to do Shockwave for him. So this gentleman, he's a 54-year-old man, and we're going to do 6 sessions of Shockwave. I find that the insertional Achilles takes a little bit longer to get better from. So that was kind of what we were working on this day. And so he did number 1, and he scheduled the other ones. Okay. Once again, hope you guys find this beneficial. We'll talk to you guys later.